of their collaborators, including the Hong Kong Red Cross. And together they represent an amazing set of interdisciplinary government, academic, and NGO partners who are already working closely together to address the risks of extreme heat now and in the future here in Hong Kong. And so I want to encourage everyone to get to know your fellow colleagues and learn from them, because they really exemplify what we feel the GIN network should be about. And this week, we've come together to shape and launch the Global Heat Health Information Network. And what I believe that brings us together to be able to do this are three fundamental common beliefs. The first is that we are all deeply concerned about the risks and realities for our families, our communities, and our countries of a warming world. Secondly, the network has one fundamental goal, and that is really to be able to help you. In whatever your role is, to be able to have better information, to make the decisions you need to make, to do your job more effectively, and have a greater impact in addressing this risk we face together. Next few days. But this is really a pioneering conversation about what we need to do, how we need to do that differently, and how we need to work together to get it done. And so each of us is really a part of this solution. And we need to talk to each other, we need to help each other, we need to innovate together, and we need to assess what is working, what is not working, so that we can advance together. And we also know that we need to partner, and we need to partner widely to be able to get this done. So the conversation really starts now, and we're extremely happy that each of you are here to be a part of this conversation. So what is the GIN? Well, we have intentionally not set the structures and function and priorities of this network. Instead, the network really will be shaped by the needs and issues that you all bring forward this week. a survey that we will share with you and ask you to fill out so that we can review on the third day what you all think we should be focused on. We'll also have a team conducting interviews, so I encourage you to talk to them if they approach you. And if you think of something that you just didn't get the chance to raise your hand and say, follow up with our reporters and say, you know, can you please note down, I think this is really important, but I didn't have the chance. Tomorrow is really where we roll up our sleeves. We're going to be having technical workshops on 5 key themes that my colleague Julie will tell you more about later this morning, but we will focus on teasing out what are the priorities in understanding heat risks better. What is the information that we need to make decisions about managing this risk? What kind of partnerships and capacity do we have and do we need to address this risk together? And then what actions and interventions are we implementing, and what do we know about their effectiveness? Now, day 3 is also a special day because it's focused on communications, because we know understanding the risk and communicating this risk effectively is really the linchpin of making change. And we've heard in other meetings that this is something that we really needed to confront head on. How are we communicating the risks of heat across timescales, both currently and in the future? And so we'll have several dynamic activities happening around communications. And then finally, we will come back together to look at the key messages that have emerged from the technical conversations and look at the future for the GIN network. And then on day 4, our local hosts have graciously opened their doors to welcome us to their project sites to learn more about what they're doing and be able to talk to them about how they've done this work here in Hong Kong. We will then have a closed meeting of our steering committee. So with that, I would like to now introduce our esteemed guests that are our hosts for this meeting. We have Professor Webster from the Faculty of Architecture at the Hong Kong University, Dr. Shun from the Director of the Hong Kong Observatory, and Dr. Tian from the School of Public Health at the University of Hong Kong. I would like to welcome Professor Webster.
Thank you. Just a few words of welcome. I am delighted to welcome you all here. This is an amazing event and an amazing array of interdisciplinary minds, expertise, brains, hearts, and everything else that is going to go into making this a success. I think there's a number of reasons why it's particularly appropriate to have the launch of this network in Hong Kong and with a Faculty of Architecture co-hosting along with medical people in the public health and climatology in a government-linked observatory. One is that the world is urbanizing, possibly moving towards 80–90% urbanized in the last quarter of the century. So the heat health issue will increasingly be an urban issue, and the way you plan and build, manage, govern, moderate, adjust urban habitats will be a fundamental part in the response. Secondly, Hong Kong is possibly the world's most iconic high-density city, and that's one of the reasons that there's a close link between these three representative bodies, if you like. A lot's already being done, conversations are already being had. Then another reason is focusing on my own faculty, architecture. The Faculty of Architecture in Hong Kong U is multidisciplinary. It's not just a faculty where they build buildings. It's urban planners, construction managers, landscape architects, and most of the built environment disciplines. I was at one of the excellent workshops that our friend and colleague Edward put on a couple of years ago at CUHK, which is, of course, where a lot of the local expertise here has been focused and has been developed. And I was struck that a conversation by climatologists, principally climatologists, energy scientists, in the end, nearly always, for most of the talks, came to the point of health. You know, these are the two impactful endpoints of a lot of our discussions. There are others, of course. But once you've got there, there's another jump. As with nearly any academic discussion, conversation, and the jump is between science and action. And in an architecture school, we cannot get away from the idea of science plus action. My architects like to jump out there and intervene, fill up spaces in cities, redesign the canyons of the metropolitan form, etc. Anticipate sea rise and adjust urbanization strategies for the Pearl River Delta for the next 50 years. They'll often do it without science, because that's the way architects are trained. When they can do it with science, that's even better. And there is a willing partnership for the application end of your science in schools of architecture and urbanism. That's one of the critical issues. The other critical route to go to application is obviously public health policy, and there are others too. So that's where we're coming from. We hope to have a lot more input from you and the network as it develops in the coming years, and not just for conference conversation, but for real action and real change. So thank you very much for coming. We're very glad to have you here.
Good morning, everyone. On the behalf of School of Public Health, the University of Hong Kong, I'm very privileged and pleased to join Professor Webster and Dr. Shun from Hong Kong Observatory and other colleagues to welcoming you to this campus. It is fitting for us to discuss heat and health in such a nice winter morning of Hong Kong because climate change and global warming are long-term trends, and we need to be prepared for the heat waves in the next summer and next decades. So this is preparedness, common sense, and good public health. As a highly urbanized city with high population density, Hong Kong experiences heightened health risks for several reasons. One is the intense urban heat island effect. Hong Kong is also a city with an aging population, which is especially vulnerable to heat risks. Public health professionals have been watching closely the heat risks due to the increasing extreme temperatures in Hong Kong. The lessons and experiences here from Hong Kong will be useful for other cities in the world. But Hong Kong can also learn from the other cities in the world. That is this forum is about. Okay, this exchange through this information network is essential from local to global. Climate change and its effects are not uniform. Even within the small geographic area of Hong Kong, temperatures may vary by up to 8 degrees Celsius across several microclimates. This kind of spatial and temporal variabilities allow us to study how heat affects health. So public health researchers and also urban planners in the architecture, we have been working closely with the Hong Kong Observatory. We are very grateful to the kind of assistance from the Hong Kong Observatory in the kind of research and also practice in the past kind of years. So this is one good example of collaboration across sectors within a city, within Hong Kong. In terms of global cross-sector collaboration and information sharing, Hong Kong looks to organizations like World Health Organization, the World Meteorological Organization, and NOVA for examples. So therefore, we are very pleased that the three organizations, they are collaborating to set up this Global Heat Health Information Network. And they are kickstarting the first global forum on heat and health here today in Hong Kong. I wish this first forum on global heat and health a success, okay? And also look forward to the kind of exchanging of ideas and then building capacities and then for the heat health management. Thank you all very much.
So first of all, on behalf of the Hong Kong Observatory, welcome you all to Hong Kong for those coming from overseas. And in fact, it's our pleasure to co-host this forum for the first time. And in fact, I think it is of this nature, getting the weather and health specialists together, maybe first such a forum in Hong Kong. Of course, being a weather service, I cannot resist talking about a little bit about the weather. As Professor Tian mentioned, we are in the winter morning, but I don't think we feel winter yet. And actually, in Hong Kong, we consider 12 degrees as a threshold, as cold weather. But so far, we haven't yet got there. Last week we have some a little bit cooler weather, but 12 degrees is not yet in sight in this week or even after Christmas. So yeah, people are already aware that climate change is real and is getting more serious. Of course, we have been saying that records have been broken in terms of the 10 or even more every year in terms of high temperatures. Just last year, before the approach of the Super Typhoon Hato, we had the highest maximum temperature on record in the history of the observatory's 135 years. And of course, this year, many of us still remember the very severe typhoon, Manaenkova, which brought us extreme weather of winds and storm surge, not seen before in the past 30 years. So I think we are now hopefully convinced that we need to take urgent actions for our society to be more resilient and also for us to adapt to climate change. As our speakers already mentioned, Hong Kong's very unique place in terms of population density, building density, and also an aging society. So we need to innovate in order to combat climate change in the years to come. First of all, I think Hong Kong Observatory has done something in the past several years to design a heat stress information service, particularly for the population of Hong Kong. We make use of, now is already a patent, a WBGT measurement system that we design in-house. And we also get health data from our partners, through our partners from the hospital authority. We correlate the WBGT data with the hospitalization data to come up with a system that is suitable for Hong Kong. We don't just use the WBGT coefficient, we use locally evidence-based coefficients. And we launched the service in 2014. And also, for the aging population, apart from science, we also need care. And so we also closely collaborate with an NGO, the Senior Citizen Home Safety Association, in the past decade. We provide caring information for the elderly, especially before the approach of very cold weather. And also, we provide, through these NGOs, caring messages to the elderly on a one-on-one basis. And also, web page and dedicated web page and apps for the senior citizens. And our experience and practice has already been recently documented in the WMO-WHO Joint Climate and Health Office publication on climate service for health case studies. And it's, again, in the highly densely populated urban environment, we need to get more data to support future studies and also research by the academia. And so now we are now taking forward, again, another innovative project to install microclimate stations in the street level. We developed our own very small IoT sensors. We already deploy in the Kowloon Peninsula area, and we're also spreading to other districts. And hopefully we'll be able to obtain more micro-scale data to support a lot of applications, not just weather forecasting, but also urban design and others. Of course, the urban heat island, I think it will be quite interesting to know that even a small change in the wind direction will give you a very different picture of the urban heat island that the data has already started to reveal. And it's not just science and innovation. We think that we also need to capitalize on effective communication with the public, because for effective warning and information provision for the public to take actions, especially before the approach of typhoon and heat waves, we need effective communication. And so the HKO has been rather good to have developed a mobile app known as the My Observatory that we typically got last year, for example, 160 billion page views in the year, and providing all sorts of real-time weather information, including the heat-related warning information. And now we have registered a cumulative download of more than 7.6 million of the app, and so it's even more than the population of Hong Kong now, because some people own more than one mobile phones. So and also we launched after some trials our official Facebook page. Again, this is a very important media to outreach to the public, especially the younger generation. Of course, in other parts of the world, Twitter is the important channel. And we find that being a scientific organization, we have spent some efforts to engage journalists, for example, those who are more savvy in social media to help us communicate. And we find that it's particularly effective before the approach of the Super Typhoon Mangkhut this year, with very high popularity of our videos, public educational videos on storm surge, on typhoon threats, and that contribute to the minimizing the loss and damages to Hong Kong after that super typhoon. So in the years ahead, we look forward to work together with all of you. We need to take urgent actions, as I mentioned, to make Hong Kong and to make the world more resilient, to take adaptation actions. It's not just science and innovation, and also we need communication skills and also public education. And also, from my experience, we need more closer collaboration between the weather, climate, and the health communities, especially how to promote the more effective sharing of data. Without the data, in this coming world of big data, I don't think we can do a lot. So I think this is one of the key message that I like to convey. And we look forward to working with other government departments, academia, sitting all around here, and also, of course, the local and international communities, including Jean. So without further ado, I wish you all a pleasant stay in Hong Kong for those coming from overseas, and try to appreciate the dense part of Hong Kong, but also we also have the rural part, the country parts that also, if you have time, please try to explore it. Thank you.
Thank you. Well, I'd again like to thank you for hosting us here to have this meeting, and also for your leadership in this field of work and working together and really exemplifying what we hope this community will look like in the future in other parts of the world. So thank you again. I have one more welcome statement, which is coming to us from Geneva.
is that the year will be fourth hottest on record, and the last four hottest years were the last four, 15, 16, 17, and 18. And in the report, we have a number of extremes which are reported by the countries, and the heat waves have been especially outstanding in Europe and also in Japan, and they have led to the several fatalities and created wildfires, which in turn also have adverse effect on health. We also see very concerned figures from the statistical reports. For instance, UNICR recently published in October 20-year statistical report on the disasters, and it says that during this period of time, 98 million people have been affected by the heat stress or extreme temperatures. So this number is getting higher, and with the changing climate, the intensity and the return period of heat waves will be also increased. We have, with the WMO and World Health Organization, we have a long record of very successful cooperation. When we work together and when we produce alerts, warnings for the people, for the governments, then we are able to save lives. For us, every life matters. So besides air quality and some other health effects of climate and environment, we now would like to take increased effort to help to predict and prevent the health impacts and deaths related to the heat. So we are very happy and welcome that these two communities are now gathering in one forum, and we would like to put all expertise of WMO, our scientific research programs, our observing systems, our ability to spread information and products through the common alerting protocol systems, through the global warming systems, so that this information comes in the hands of those who can act on it. So we're very happy that this event takes place, and we look forward that the network which is being created now will then serve as an expert resource to improve health-related services, which national weather services could, together with health authorities, could provide to the people. We welcome all participants, and we thank host for Hong Kong for having the expert event. We also thank Hong Kong Meteorological Observatory, which is one of our champions in global multi-hazard alert warning systems, and we look forward for the successful results of this forum so we can take it further. Thank you.